Good morning, PT on Ice Daily Show. My name is Dr. Jessica Gingrich, and I am one of two TAs for the CMFA Pregnancy and Postpartum Division. Today, I'm going to talk about vulvar varicosities during pregnancy and how we can help manage that. Before we dive into the joys of this, I'm going to talk about some courses coming up. So our next online CMFA pregnancy and postpartum course is starts tomorrow, actually. So if you want to jump in last minute, head to the website to sign up. The next online cohort begins January 20th, and the next live course is May 21st in the beautiful Bellingham, Washington. If you are interested in learning how to keep your pregnant and postpartum athletes under the barbell, head over to that website, ptonice.com, to sign up. All right, so the first thing we're going to talk about is what is a vulvar varicosity. So it's essentially a varicose vein that typically presents during pregnancy on the labia majora or on the vulva. This typically happens because the weight of the uterus starts to grow, blood volume increases, and then also the hormone progesterone increases during pregnancy. This can cause bulging of the vein that appears just under the skin, and it's a bluish purplish color. Usually when people start feeling this, they do look and they can see it. And so that might be something that they are telling you, that they see this purplish, bluish vein. Sometimes they don't look, and so that's something that they don't want to see, and they just tell you that some of the stuff that they're feeling that we're going to go over here in a second. So common reports that I hear is obviously they're seeing something, or they feel fullness, pressure or pain on the vulva, pain in the upper thighs or even lower back. They usually have pain with walking, intercourse, and sometimes they itch. And so that's another symptom to be on the lookout for, is that itchiness. One of my favorite things that we can do is help relieve some of this stuff, and also encourage that or ease their mind that these typically go away after pregnancy. So how do we manage this? Teaching the Kegel. The Kegel is almost becoming a lost art. You're seeing this a lot on social media, that pelvic PT is not all about the Kegel. And that's true for some of our clients. However, your pelvic floor has to do a Kegel at certain times during your day. And so teaching the Kegel is always a good idea, just in general. But to prevent or lessen vulvar varicosities, it's a great tool. So you have the pelvic floor muscles here that lie parallel to your diaphragm that lives up here. When you do a Kegel, your pelvic floor will lift and drop, as well as your diaphragm lifting and dropping. And so using this tool to help kind of pump and promote fluid in and out of the pelvis is awesome. Teaching Kegels looks different for everyone, just like different cues and tactile cues look and feel different for everyone. And so finding what cue works for your patient is how it's going to work. If you are not an internal therapist, ways that you can communicate this with your client is, what are they feeling? And so typically what I say is, I want you to feel a squeeze and a lift. If they only feel the squeeze, that's okay. That's something that can be worked on. After they feel that squeeze and the lift, I want them to feel it relax or drop. So asking your client, what do you feel? Do you feel anything move? Do you not feel anything move? Do you feel like something's pushing or bulging out? Having them reflect on what they're feeling is very powerful. Gives them a lot of autonomy and independence when they go home and they use this. One of the bigger things that I say with the Kegel is making sure that relaxes, making sure that the pelvic floor relaxes as well. And a great tool to help promote that is diaphragmatic breathing, which is the next thing that I love to teach people how to do. So coming back to the pelvic model, pelvic floor here, diaphragm parallel. When we inhale and exhale, you get a great amount of movement of the pelvic floor. So using this is a great tool to use throughout mom's day, because it doesn't mean she has to go sit down, lay down, or even take time to think about the Kegel. So if she's on her feet, if she's running errands with 2 or 3 kids on her hip or in the buggy, she can use this tool to help kind of promote that movement and get the symptoms of the vulvar varicosity down. So just like the Kegel, cues work differently for different people. I love to use the cue, inhale into your belly will expand. I've heard the cue of a 360-degree breath, opening an umbrella into your rib cage. Different cues work for different people. Have them put their hands on their chest and their belly. Let them feel what that feels like. I often hear that chest breathing is bad for the pelvic floor. I would not say that it is bad for the pelvic floor. It's just that we can breathe differently, and getting into different parts of our lung tissue is great. And it helps promote that movement and that fluid mobility into and out of the pelvis. Other great options to help with this is positioning. And so mom comes home from a busy day on her feet. If she can find time to lay down for a minute, put some pillows under her butt to prop her butt up, or laying down, if she can tolerate that, with her feet up the wall, can help bring that blood flow back towards her heart and decrease some of that swelling. Sometimes that positioning is not always feasible for mom, especially if she's got other kids at home. But if she can get into those positions, she can also use the Kegel and use the diaphragmatic breath to continue to help promote that fluid. There are some passive treatments that can be used. One of the more popular ones is going to be a V2 supporter. And essentially it looks like a jock strap. So when you see, if you Google it, you'll see it on a mannequin or on a model, typically over leggings or spandex. And it looks uncomfortable, but mom would put it on underneath of her clothes. And what it does is it puts pressure and compression on that perineal body, helping to decrease the swelling and the pressure of the vulvar varicosity. Another option is compression shorts. It's similar to a V2 supporter, just providing some compression. Now, the biggest thing that can help with vulvar varicosities, you guys are going to be shocked when I say this, but is exercise, right? Something that we've been talking about forever to help with everything is exercise. It's becoming more accepted and more encouraged for our pregnant mamas to be exercising, but I still get the people who hear that it's bad for them, right? Don't lift that heavy box of feathers, right? You're gonna hurt yourself or hurt your baby. It's just not true. We need to be promoting exercise. You're not gonna ask your accountant to pair the best red wine with your steak, right? We should be teaching this. Getting under the barbells, getting into a gym, understanding how it feels to get our heart rates up, to be under a heavy barbell, and what it feels like to our muscles, what it feels like to our lung tissue. How does it feel when those endorphins are released? This is a powerful tool that we need to be using and promoting this into our pregnant population. Okay, so let's bring it back around. So vulvar varicosities are varicose veins. They appear when the uterus starts to get bigger, progesterone starts to increase, and your blood volume increases. There are certain risk factors that make someone a little more prevalent, but right, that's not going to change our treatment. We are still going to help decrease these symptoms by using a Kegel, remembering that different cues work for different people. But the biggest thing that you can do to help promote this is asking your client, what do they feel? How do you feel when you do a Kegel? Can you do it seated? Do you need to lay down? Let's try it standing. The other thing is going to be the diaphragmatic breath, using that in different positions. Maybe they're sitting, maybe they're standing, maybe their legs are up the wall, pillows under their butt, using that positioning and that breath to help promote that fluid back from the lower extremities into the pelvis, back towards the heart. Passive treatments, I always like to make sure that I tell my client that this is a passive treatment. There are active things that can help promote movement of that blood flow, but the passive treatments are a V2 supporter or compression shorts. And then the number one thing that we want to be doing is teaching our clients how to move, how to exercise, and telling them that it's safe. This is something they should be doing for them and their baby. All right, team. I hope you guys have a great Monday and a great week. We will see you tomorrow. And I hope that everyone has a great week.